friends. Today we're going to discuss about psychotherapy for internet addiction, also cognitive behavioral therapy for internet addiction. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about internet addiction, the diagnosis, prevalence, comorbidity, and psychotherapy. Again, in psychotherapy, how the assessment is done, what is the process, motivational interviewing, and then finally, cognitive behavioral therapy for internet addiction will be discussed in this video. Let's understand about internet addiction. The internet addiction is not been considered as a diagnosis as per DSM-5 and also ICD-11. However, internet gambling and gaming has been considered. Invariably, the internet addiction is a medium where the internet is used for consuming various types of content. It can be pornography, it can be gaming, it can be gambling, it can be even nowadays for the purpose of various other social media usage, compulsive chatting, and various other purposes it has been used. When this internet addiction comes in the way of growth, academics, job, social function, and biological function, then the internet addiction can be considered. Since at this point of time, none of the diagnostic criteria considers internet addiction as an illness, hence there is no insurance, less research has been invested in this, but few researchers like Dr. Keith Beard proposed a diagnostic criteria for internet addiction. I'll be discussing about this Keith Beard's criteria for the presence of internet addiction diagnosis. Out of 8, 5 symptoms if it is there, then the internet addiction can be considered. Let's look into these 8 important criteria. First one is preoccupation with the usage of internet, tolerance, unsuccessful efforts to control or cut down the internet usage. The fourth one being staying online longer than required. Fifth one is withdrawal symptoms, having jeopardized or risked the job, academics, failure in exam because of internet usage, deceptive and conceiving behavior with regard to internet usage, and finally, the internet is used as a way of escaping from boredom, depression, and various other dysphoric modes. So out of this 8, if the 5 criteria are there, then it is considered as internet addiction. Let's look into the prevalence. Yon Chain-Pan and his colleagues in 2020 published an article. This is a systematic review and meta-analysis of epidemiological studies of internet addiction. This is published in Neuroscience and Biobehavioral Review in 2020. This study looked into 113 epidemiological studies on internet addiction, comprised of 6,93,306 participants covering 31 nations. And this study reported 7% as internet addiction and 2.4% as internet gaming disorder, my dear friends. 7% across 31 nations. 6,93,000 participants is a huge number. It is a public health crisis now, my dear friends, affecting children, adolescents, adults. That means we have to be on the toes to control this public health menace. This internet addiction does not come alone. It comes with comorbidity. That means another illness also comes together. Depression, dysthymia, obsessive compulsive disorder, attention deficit hyperactivity disorder, anxiety disorder, generalized anxiety disorder, social phobia, other substances like tobacco dependence, alcohol dependence, cocaine, opioid, impulse control disorder, personality disorder, and sleep disorders. So these are the various comorbidities are known. Invariably, the studies clearly say that comorbidity is the rule in internet addiction. That means 2/3 of the cases, 70% of the internet addiction people have comorbid psychiatric diagnosis. That means the rule of thumb is When you see an internet addiction person, invariably will have a second diagnosis. 70% of them will have. Invariably, we do not know internet addiction causes this comorbidity or comorbidity causes internet addiction. For example, if a person is depressed, he may wants to overcome this depression by using internet. Or else, a person who is having sleep problems is unable to sleep in the night, hence he is using internet and becomes addicted. That is one way of thinking. The second one is because he is using excessive internet and he is addicted to it, he is unable to achieve anything and his socio-occupational functioning is disturbed, hence he develops depression. Since he is using internet too much, he is unable to sleep also. So it can be comorbidity, can be either way. Hence it is very difficult to know whether the chick came first or the egg came first. So in this regard, considering the comorbidity as a rule should be considered here. Let's look into the assessment. When you do an assessment, you need to do a comprehensive assessment because comorbidity is very well known. Look for the chief complaints, history of presenting illness, look for comorbidity. If you're seeing a patient with depression, ask for internet dependence. If you're seeing a patient with sleep disorder, ask for internet usage. That means in both ways it is very essential. Check for any legal, economical, social, and interpersonal complication because of internet addiction, past history, family history of any substance use, alcohol use, personal history, ask for comorbid drug abuse, premorbid personality, whether he is a loner, alone, social withdrawn, broken family, general physical examination. Look for his hands, carpal tunnel syndrome. These are very essential, obesity, and look for the hyperthyroidism and thyroidism. Do a mental status examination, cognitive function. Once you do the cognitive function, ask for the insight regarding internet addiction. Ask him whether the internet is causing a problem or is helping him. If he says yes, it is causing problem, what is the reason for this internet usage? Whether it is an internal locus of control or external locus of control. And whether there is a motivation to give up for treatment. Reason for using internet also be checked, and also ask how many hours of using internet is there. By doing this 360-degree comprehensive assessment is very essential before you embark into treatment. If there is a significant comorbidity, you may have to use medication and then therapy. Invariably, the combination of medication, psychotherapy, exercise, spirituality plays a very important role in overcoming internet addiction. Now let's look into the reason for internet usage, how the people say. There are two important reasons. One is positive expectancy and avoidance expectancy. Positive expectancy is for pleasure, fun, positive emotion, and feeling good. Avoiding expectancy is distraction, boredom, being in depression, avoiding loneliness, avoiding from annoying duties. So invariably, positive expectancies are difficult to treat because it's a pleasure driven. Avoidance expectancy, if you are able to overcome these poor coping skills, boredom, depression, it is very easy to defeat internet addiction. But however, you need to know whether it is positive expectancy, avoidance, or combination of both can also be there in the same person. What are the tools used for quantifying the internet addiction? The commonest is Kimberly Young has used internet addiction test, which is available everywhere. I'll be discussing that shortly. Problematic internet usage questionnaire, compulsive internet usage scale, and Chen internet addiction scales. These are the four important, but I usually use internet addiction test. This is by Kimberly and Young. In 1996, she has given this. It is a self-administered, and each item has 0 to 5 rating. 0 is not applicable, 5 is rarely, 2 is occasionally, 3 is frequently, 4 is often, and 5 is always. Based upon this rating, each item is recorded. Let's look into this. 20 statements or 20 items. These are the various items from 1 to 10 have been given. For example, how often do you find that you stay online longer than you are intended? So he has to make 0 to 1, 0 to 5. What is the number? Similarly, how often do you find yourself anticipating when you will go online again? That is craving. So these are the various 20 items have been given. Since it is 20 items and each are measured on 0 to 5, the maximum score is 100. The higher the score is, severe is the internet dependence, and 0 to 30 is the normal. Score between 31 to 49 is mild level. 50 to 79 is moderate. Anything above 80 is severe internet addiction or dependence can be considered. This is available online, free of cost. Please use this for quantifying internet addiction in your clients. Now let's move into psychotherapy. But if there is a comorbidity, please address this comorbidity. It may be depression, it can be OCD, it can be ADHD. Once you decide for psychotherapy, you need to understand there are two approaches are usually used. One is cold turkey method. That means completely going for abstinence. This is well done in opioid, in alcohol. But in internet addiction, it's simply impossible. For some reason or same reason where internet has become ubiquitous, penetrated every part of life, you cannot avoid internet. Hence, the harm reduction strategy is the best strategy. That is moderate, mindful, and value-based usage of internet should be used. Here, you are not going for an abstinence. You are going to moderate it. Harmful reduction of internet usage will be done. Hence, you will be using eclectic therapy in psychotherapy. That means it is a combination of CBT techniques, mindfulness, motivation strategy, supportive therapy. All those will be utilized in internet addiction psychotherapy. So, considering this, the approach will be regulation, regulating both internal and external locus of control. Internal will be enhancing the self-control over the internet usage, and application of external control by using various apps, blocking internet, connecting internet when it is required, monitoring the internet usage by people, by applications, firewall blocks, and blocking certain apps. If the person is using pornography, blocking the pornography content. So you're using both internal and external method to help the person to overcome internet addiction. That is, both internal and external locus of control will be used. Invariably 16 to 24 sessions, 1 to 2 sessions per week, 3 to 6 months over a period of this internet addiction is done, therapy is done. And invariably the best will be therapist assisted in-person therapy. And we need to prepare for relapse by using booster session. That is the best way to go for internet addiction. And invariably it is outpatient based therapy. However, in China and US, inpatient, rigorous, complete cold turkey methods have been used. In China, a military way of complete blocking internet and complete detoxification over a period of 60 to 90 days have been used and found to be useful, but however, relapse rates are high. But whether that is the best method, we do not know. Still, the research is ongoing. But moderation, since the internet is available everywhere, harm reduction is the best way of treatment in internet addiction. Let's look into the various steps in psychotherapy. First one is educating about internet addiction. If the person is showing resistance, applying motivational interviewing, motivational enhancement therapy. Once he is ready, moving into cognitive behavioral therapy for internet addiction. If there are family issues, bring in family issues, couple therapy, harm reduction, exercise, yoga, and group therapy can be considered in internet addiction. First and the foremost is providing education. Provide educational material, workbook, self-therapy book, and online apps. So these can be utilized to understand about internet addiction, the time usage, duration usage, money spent, and the dysphoric mood after using. These are the methods to provide education. Now moving to motivation to change. Invariably, many of the people who are using internet, either they are young adults or adolescent, many of them have poor insight into their internet addiction. 40 to 45% of the people who are using internet or internet addicts do not have insight. They refuse to consider internet as a addiction in them actually. There are many reasons for this. The poor insight is because internet is used ubiquitously by everyone. Internet is available in everybody's pocket, that is smartphone. It is very difficult to keep a person away from the internet since everybody is using it and it is anonymous and it is available at the palm tip. From awake to sleep, it is used and it is socially accepted, not sold by underworld gang, and it is culturally accepted. Hence, it is very difficult to control this. Invariably, high amount of denial, normalization, cultural acceptance has caused difficulty in identifying internet usage, and it is used in the occupational space, academic space, and research place. Hence, it becomes very difficult to know who is addicted to internet. Invariably, the presence of comorbidity and stigma plays another crucial level in accepting internet addiction and for treatment. Then you have to look into which stage of Prochaska and DiClementis model of change theory to be applied. Whether the person is in pre-contemplation, contemplation, preparation, action, maintenance, and relapse. Invariably, in pre-contemplation, complete denial will be there. He will not accept internet is an addiction, or he has addicted to it and it is a problematic. Invariably, some people may be in contemplating stage. Yes, it is causing some amount of problem, but it is also helpful. Now, moving for preparation, gathering information and taking action. Here they will understand, yes, I'm using excessively, I need to cut down on this. And moving to the action, seeking help and trying to make efforts to cut down. Maintenance, once they are able to control the internet usage, they are maintaining it, and sometimes there will be relapse. Invariably in this stage, there can be lapses, can occur anytime. That means whenever there is a free time, the person may use internet more than required. So this is what the Prochaska and DiClementis has given with regard to motivation. With this now, we have to move on to the theory models like trans-theoretical model. Pre-contemplation, no, he does not want to change. In contemplation, maybe he wants to change. Preparation is planning, action taking, and finally maintenance, keep going. So these are the summarizing the trans-theoretical model of changes. In which stage the internet addiction person is there, you have to see and move step by step. Invariably, many a time, because of the relapse and lapse, the person may go up and down. You have to understand that these are the steps for theoretical model. In reality, they can move up and down based upon their motivation to change. Now let's understand how motivation works in real world. Let's look into this graph. On x-axis, that is motivation, and y-axis is time. As soon as the person finds that, yes, internet is causing problem, the motivation will be very high. The person wants to quit, goes for a treatment, and he may stop. So invariably, the motivation will be very high. And at times, there will be relapses. That means motivation gets down. That means invariably in treatment of any addiction, lapses and quitting is the journey. It's not a straight line. Motivation is dynamic in nature. The course and outcome of any substance use, the rule of thumb is relapse, lapses. Hence, one need to be aware of this, enhance motivation, make sure the person spends more time away from internet or alcohol or substance use. By doing this, you'll be able to achieve a good position in the society. So again, this diagram clearly indicates the motivation is dynamic in nature. It is not a straight line. Everybody, the family members, and even the therapist expects the green line. The way he is become a robo and he does, the outcome is good. Invariably, it doesn't happen. Motivation fluctuates. Invariably, over a period of time, multiple relapses, slowly the person becomes away from the internet or any substance. That's what we need to understand here. So don't expect there will be no relapses. Relapses is the rule of thumb in any drug abuse, alcohol, or substance use treatment. So again, you can see the motivation is fluctuating, dynamic in nature. Invariably, the discipline, being in contact with the treatment team, plays a crucial role in the outcome of substance use or even internet addiction. That means they have to be in constant touch with the treatment team, invariably every 2 months or once a month. Being in touch with helps to control lapse and relapses. Now let's understand, if there is a motivational problem, then you need to employ motivational interviewing technique. The process of motivational interview has 4 steps: engaging, focusing, evoking, and planning. So these are the 4 steps. In engaging, you will be using ORS method, that is developing rapport, connection, and trust. In focusing, invariably you will focus on certain outcomes. You will ask permission to discuss about certain problems. Let's discuss about the online usage. Take permission and then ask what kind of help he requires. If he says he does not want to discuss about this, you have to move on, not focus on internet usage. If he focuses, yes, I want help, then you will move on to the evoking, sustain talk, and change talk. What are the methods he has been adopted to overcome internet usage? And what are the difficulties he has faced? Finally, the planning. You need to focus on this planning. That's very essential. Without have a plan, short-term plan and long-term plan, motivational interview will fail. If you look at the engaging in the first step, that is ORS method, focusing, evoking, and planning. So these are the steps we are using. Now moving towards the core principles of motivational interview, that is DARES is the mnemonic used. D is for developing discrepancies, A for augmenting ambivalence, R for roll with resistance, E for express empathy, and S for support self-efficacy. So DARES is the mnemonic used, develop discrepancy about the internet usage and not able to achieve anything. Augment ambivalence, yes, he wants to quit, not to quit. Roll with the resistance, if he has any resistance, discuss about that. Express empathy about the difficulty he's going through. Support self-efficacy, because he is the one who has to overcome the internet addiction. Further, you are going to use the important technique which is called as frames. The frames, again the mnemonic, F means feedback, R means responsibility, A means advice, M for menu of options, E for empathy, and finally self-efficacy. If you look at the feedback, here you'll be giving the feedback about the internet usage, what are the problems, looking at his academic scores, you will be discussing about that. And the responsibility will be placed on the client, telling that yes, he's the one who is going to take responsibility in overcome the internet addiction. It is not we are going to help. He has the strength to overcome. That is the place you are going to place. And here we are going to explore together to overcome the internet addiction. That means the power is inside in the client, not I'm going to give you like a prescription. It is a responsibility is on the client. Advice, if required, whenever. Menu of options. You are giving options of various coping skills to overcome internet addiction. And finally, empathizing the difficulties facing. And finally, the self-efficacy. Now let's look into the procedure of motivational interview. Invariably in the procedure, the motivational interview is used between 5 to 10 minutes, sometimes 15 to 30 minutes. It can be used in OPD, IPD, community settings, or in the office. It is deployed whenever the patient shows ambivalence or resistance for treatment of internet addiction. Any number of sessions can be used. There is no fixed number of motivational interview. Each session will be lasting for 5 to 30 minutes. That is how I can explain. And it's not employed in wherever there is a serious comorbidity, serious dependence, and psychopathology like delusions, hallucination. You're not going to use it. Invariably, if the patient is very violent, you will not use motivational interview. If the patient has just an ambivalence and resistance, you will be using this motivational interviewing technique. MI technique can also be used along with various other therapies. It can be cognitive behavioral therapy, it can be mindfulness therapy, marital therapy, family therapy, and various other therapy. That can be a prelude to various other cognitive behavioral therapy or therapies. Now let's enter into the cognitive behavioral therapy for internet addiction. There are 3 phases. One is behavioral modification, second one is cognitive work, third one is harm reduction. Let's talk about the behavioral modification. Here we are going for internet hygiene or online hygiene. Second one is stimulus control. Third one is internet regulation. Fourth one is relaxation. Phase 2 is cognitive work. You'll be doing cognitive behavioral work. You'll be challenging the cognitive distortion. And finally, the harm reduction, that is relapse prevention, will be done. Let's move into the first step. In that internet hygiene. Here you'll be talking about using internet whenever he is with other people. Not use internet when he is alone. Using internet in the open space, that is in the public, not alone. And invariably, fixed timing schedule will be used for internet usage, not in the night, not whenever he's alone. That internet hygiene has to be developed. That means very specific timing and used for specific purpose, not for the purpose which is dependent. For example, pornography, gaming, gambling should not be used. Stimulus control. Here again, the focus is on using internet for constructive purpose. It can be work, it can be academics, it can be for day-to-day usage of like paying bills, online banking, removing devices like mobile phone from the bedroom, from the drawing room. And internet should not be used in the bedroom so that it is controlled. It is not available ubiquitously anywhere, any place. That should not happen. And whenever the internet is used, frequent breaks are essential. Every 10 to 20 minutes, there should be a break of 5 minutes when the internet is used. And monitor the usage. That means family members will be looking after when the person is using the internet. Third one, regulating the internet usage by using various devices. It can be app-based, application-based, that is firewall-based, controlling the IP, device-based regulation, fixed time of usage, and abstinence from the problematic online applications. It can be pornography, it can be gaming, it can be gambling. That means internet is used for legitimate purpose. You're not using internet, you're not going to have a complete abstinence. It will be used for the harmful reduction. That means it will be used only for the constructive purpose. The fourth one is relaxation. Maybe using yoga, JPMR, exercise, sports, focusing on positive lifestyle, hobbies, singing, listening to music, and various other non-technology based hobbies can be utilized for relaxation purpose. Fifth step will be CBT. Here, you'll be monitoring the thoughts and cues for triggering the internet usage. Cognitive work should be initiated, looking into various cognitive errors, what is the cognitive schemas, and automatic negative thoughts, which triggers the internet usage. When he gets the active craving towards the internet at the height of the emotions, you'll be looking at the what are the cognitive beliefs and distortions behind that. By knowing this cognitive distortions, beliefs, and automatic negative thoughts, you'll be challenging them through Socratic questioning. The commonest cognitive distortion seen is I can only relax when I am alone or online. No one loves me. Only online people loves me. The only online people have unconditional acceptance towards me. I miss out if I'm not online. People will not respect if I'm not online. I'm worthless offline. I'm better online. I have an avatar. I have a self-respect online, not offline. So these kinds of belief systems, invariably the internet addicted people will have. Those cognitions and distortions need to be challenged. Invariably, the cognitive distortions are overgeneralization, catastrophization, selective abstraction, minimization, maximization, rationalization, negative core belief are those which needs to be challenged. Ultimately, one need to learn to use internet for the benefit or constructive purpose, not for everything purpose or for the purpose of problematic usage. The technique used is Socratic questioning, that is, to dispute the irrational beliefs, challenging the irrational belief. Cognitive reprisal, that is basically replacing distortion with the balanced thinking. Finally, reality testing, offline behavior, experimenting, the person asking to go outside, meet people. What do they think of this person? Whether they are refusing him or whether they are rejecting him. What are those real life scenario needs to be challenged. And the sixth one is relapse prevention. This is a plan. You need to know, yes, there will be relapses because he's online internet for anything, everything purpose. Hence, identifying the high risk situation, treating the comorbidities, developing coping strategies. Like whenever there is an urge to surf, delay the distraction, using distraction, delaying methods are the used, using various coping cards, relapse prevention strategy, involving parents and significant others in stopping internet usage, and also involving family members in cognitive behavioral therapy plays an important role. And finally, the booster session to make sure the lapses and relapse are under control. The final step is modeling. Here, when the patient or the client is able to quit the internet problematic usage, the family members also has to respect and also should be behave in similar fashions. Like in diabetes management, everybody should have a similar diet so that the person who is using diabetic diet should not have a severe urge when a person sitting in front of him, a family member eating sugar or a sweet. Hence, the modeling by the family members, parents plays a crucial role. Time management, everybody should know that yes, at home, this is the amount of internet is used during this time, and after 8 o'clock, the complete all devices will be switched off and the Wi-Fi will be switched off. So that time management has to be very crucial. All family members should be involved in exercise, socializing, and group therapy is the best in internet addiction, my dear friends. Now let's look into the evidence. The umbrella review of treatment of internet addiction has been done. Young and his colleagues in 2024, they published an article in Current Addiction Reports journal. The title of the study was Internet Addiction, that is intervention of internet addiction and smartphone addiction, an umbrella review of systematic review and meta-analysis. This is an umbrella review. That means a review of all the reviews. In this study, 33 systematic reviews and meta-analysis were reviewed, my dear friends. These umbrella reviews, those systematic review which was done by various authors, they looked into various intervention used in internet addiction. Look at this. The number of systematic reviews included in this umbrella review was 33 reviews. They looked into psychotherapy, pharmacotherapy, sports intervention, internet-based intervention, other types of intervention, and multi-component intervention were studied. The results were stunning, my dear friends. Psychotherapy, sports intervention, multi-component intervention were found to be very useful in internet addiction. However, pharmacotherapy and other types of intervention have been found to be useful, but the limited evidence were found. To finally, the combination approach is the best treatment for simple reason. The internet addiction has high comorbidity. 70% of them have comorbidity. Hence, pharmacotherapy, psychotherapy, family therapy, and group therapy will play a crucial role in treatment of internet addiction. To conclude, my dear friends, the first step is psychoeducation, and make sure motivational interviewing is used whenever there is a resistance or ambivalence to overcome. Identify the cognitive distortions, triggers and cues for internet addiction, challenge those cognitive distortion, restructuring the internet usage and negative thoughts, developing healthy coping skills. Developing healthy usage of internet is very essential. Internet addiction does not come with abstinence. It comes with harm reduction, reduction in the problematic content use of internet. It can be pornography, gaming, gambling. So those has to be reduced, and constructive use of internet will be used by the client, which is monitored either by the devices, application based, or by the family members. Invariably, cognitive behavioral therapy in internet addiction plays a crucial role, which has three phases: behavioral modification, cognitive work, and harm reduction. So, at present, the combination treatment is the best treatment available at this point of time. To conclude, cognitive behavioral therapy for internet addiction, along with motivational interview, group therapy, family therapy, all and psychotherapy plays a crucial role in the treatment of internet addiction. Thank you very much for giving your valuable time. Stay safe.